Good afternoon. Today is March 31st, 2023. My name is Kemal Erkan. I'm here from UMACO, United Medical ACO. This is our weekly event. As usual, we are going to discuss US economy and global affairs. And also we do have our RCM, Revenue Cycle Management presentation, and one of our client managers is going to join us. In fact, we are going to start with our RCM presentation, so that way Terence can go back to his work. So I'm gonna let him in first. Well, today, actually, yesterday was the Doctors' Day, National Doctors' Day. Congratulations to all those docs who are part of our system, or not our system. So they are extremely important for us. And now we are Terence joining us. Terence Morrison is one of our client managers. So, Terence, you were with us before.
Yes.
Once or twice at least.
I think twice. I think once as like the main feature, but I was with the payment posting managers also.
Yeah, absolutely. And thank you for joining us again. So today we are going to do the client communication and end of month reporting. So part of the reason we are sharing these and we are presenting is because we do want our employees, existing and new employees, to get updated. And of course, this is not our main way of sharing that information or providing that training, but it is a supporting piece of it, so that hopefully more people can benefit from what we are doing. So, Terence, you should be able to share your screen right now.
Yeah, let me go ahead here.
You got it?
I'm trying to share now. There you go. I think I'm good now. Okay, let me just start the presentation. Okay, I think I'm good now. Can you see my screen?
I can see it.
Okay, perfect. Good afternoon, everyone. My name is Terence Morrison. As Kemal mentioned, I am one of the client managers here. I'm at United Medical. I've been here for almost 8 years now. I think almost 3 years as a client manager. And I just wanted to give just a quick breakdown on our communication that we have with our clients, as well as the end of month reporting that we have at the end of the month. First thing I wanted to discuss was the client communication. Obviously, communication between UM and the clients is a key factor on how well the client performs. Usually, we see a correlation between the responsiveness of the client compared to their collection rates. So obviously, we have clients that consistently contact us. We have like weekly meetings. They call on a daily basis, and usually that reflects more collections on the payment side. There are different ways that we communicate with our clients. We do face-to-face or virtual. We actually just started doing face-to-face meetings. We had the UMACO meeting face-to-face for the first time. I think it was last week or the week before. Also, we use QuickBase, which is our secure site that we like to use, and I'll have more information on that in future slides. Also, obviously, email and direct calls from the client. And also, we usually try to reach out to the client as much as possible, even if they are unresponsive, because at the end of the day, we are also graded on basically how our clients are doing. So we want to have the best numbers for them. So if they're not responding, we're going to continue to reach out to them so that we can get the issues resolved. And this is just a quick snippet of QuickBase. This is what we see and our clients see when we're trying to make a request. This is probably the best way for clients to reach out to us if they need information updated, or if we need information such as like medical records or like a ID card or something like that. We'll use this system to request information. If you look at the snippet on the right, you'll see we have like the client name, contact. We can also search by category, subcategory. So it's really helpful when we're trying to reach out to clients, and it's also helpful for them to explain what issues they're having or what issues they want us to look into. Next, and this is also obviously part of client communication, is the end of month reporting. It is a helpful report that we use to communicate issues that we realize during the month. This report is ran the first day of the month or the following month, and displays a summary of the following information: cover page, the insurance denials, whether client or system related, and it also has financial information, which the providers are very much interested in usually. And this is just an example of a cover page for one of our end of month reports. So it'll just display the current status for the client, includes the client name, specialty, the contacts on both UM and the client side. Also under the, if you see the current ideal state of AR, that's the numbers that we go by basing the performance of the client. And also we'll provide any issues or trends that UM is seeing for a specific client will also be included at the bottom under the additional notes section. And this is just continuing on the end of month report that our providers get. We also have detailed denial lists within the report. This snippet on the right shows the amount of denials a client is receiving within a 3-month basis. So you can see here, we can just base the check-in and check-out denials for the previous 3 years, and we can just compare it to see if there's any trends. Like for instance, this client that I attached here, as you can see, the check-in denials have been going a little bit higher as long as the checkout denials. So that's something that we can bring up when we meet with the clients within our client meetings. And this is just continuing on the trend part. This is another report that we share within a report, the end of month report. This is also displaying the last 3 months, but it's breaking it down by the actual denial reason. So if you see here, in the month of February, we had a good amount of denials for incorrect insurance for a patient, also error in charge entries and invalid diagnosis. So we use this report to also see if there's any trends on a month-to-month basis. And going to financial data. So this is obviously also included, and this is what us in the office also look at when we're trying to base how well the client is doing. So if you see here, we have the actual total AR. So that's the total outstanding, both patient and insurance balances. We also have the, what we usually go by is the aging. So we try to bring down the aging, the insurance over 90 days column, and over 180 days. We try to bring that down as much as possible, so that obviously those are the ones that are getting older. We don't want them to go outside timely filing. So we have to get resolutions for those balances quickly. But it also shows the AR responsible, as you can see here, the total charges entered per month. So this is good information, usually information that clients want to see. And this is also another financial report that is included, and this just breaks it down by total charges and total payments per month. And we can also compare it to 2022. So obviously, as you can see, we have the January, February numbers in And when we look at it for 2023, we can just go back and see if there's certain issues. Maybe there's delay in charge entries for the client that can also contribute to the total payments. So we just look at this to see if there's any trends, any issues. Maybe the client is not noticing. We can just bring this up. And this is probably one of the reports that the clients go over pretty frequently. And this is just similar report that's also included. It just breaks it down by provider. This is another report that the providers want to see, just to see how each provider is doing on a monthly basis. But it includes pretty much the same information. And that is it.
All right. So you have given us a lot of information there. So just so that we are, the reason I didn't interrupt you, so then we can actually make sure that those slides are, whoever is watching that, they can actually go through those slides without a problem. But what's our main goal, right? So why do we actually have these reports? The reason we have these reports is because we need a standard way of communication, standard and routine. So those are two extremely important element of the good relationship. So if we don't have the standards with the clients, and if we don't have them on a routine basis, and if we don't have any uniformity in the way that we are presenting, which is part of being standard, so then things can actually be different. So now when we have more than 20 different specialties, what we are sharing for the end of month, these are monthly reports, is it enough? Well, from the standard core, covering the core part of the practice management, yes, they are enough. But to go into each different specialty, we may have, which we do, have a lot more reports to put a light on the specialty itself. For example, nephrology practice may have dialysis units, so then we have dialysis reports. We may have the cardiology practice, they may have a new access center. We may have a report specific to that location and the reimbursement. So these are kind of like the framework of the reports, but then we do have several other reports to support these. And one of the main issues really important for us is we do want practice owners to receive these reports. Why? Is because we want to make sure that they have full access to these reports that we are presenting, so then they are not depending on their employees or managers. They still receive them as well, but I want to make sure, personally, I want to make sure all of our reports, practice owners, do receive these reports on a monthly basis. And the other thing is, I think what we were discussing from your presentation that's really important for us is why we prefer ticket system over phones or emails is because we want to trust, but verify our system. There should be a checks and balance. So we want to know when that issue was raised by the client, what answers are being given, and if we can make any meaningful analysis out of those reports. So, for example, if the mistakes are being repeated, or how the issues are being handled. So those are two different really important things. One can be from the client side, but the other one is from our side. So we want to know how we are handling it, what answers we are giving, and how quickly we give those answers. So that's one of the main reasons that we develop these reports, and we have been using it for a long time now. As we go, we do make updates, and your team, you and other client managers, you guys are still having your meetings with the clients. We are just not sending the report and not follow up, obviously. So these are, when we meet with the clients, these are the reports that we go over. And I think that makes our picture, it completes our picture in a way that here's what we have done and how we did it. And then at the end of the month, we have our meetings and we can discuss everything from the prior month and what may be coming in. These are very important presentations for us. Thank you for being part of us and presenting. So it's always more productive when I have you guys joining me. So I'm sure we'll see you again in the other sessions.
Of course. Thank you so much for having me.
Thank you. All right, so I'm gonna let Sean is gonna join me and we'll start our other updates.
All right, I'm in.
So let's do the time check. So it's 2:13, so 2:20 actually.
2:20.
So we do have Bariatric Friday with Dr. Erkan at 3 p.m. And we're going to discuss the multivitamin issues for bariatric patients. Now, in the last couple of weeks, we were planning to discuss and go into the details of the global currency.
Mm-hmm.
Now, that came up not because of the recent changes, but in our conversations, part of our conversations, I'm just giving you some unnecessary updates from what I know and what I project from certain things, but then some of them are recent stuff.
Right.
So once we start having financial issues after the pandemic, where we added the global affairs, the global updates, and then understanding what's happening around the world and how it's important, why it's important for us. I think that's why we want to discuss the currency issue.
Right. Yeah, I would agree. As you mentioned, after the pandemic, the global economy obviously was impacted in ways that it wasn't, ever before. And such a novel experience that we had. And I think some of the things we've been covering in some of these sessions, including the Russia-Ukraine conflict and those ripple effects that these topics have, that we on our show kind of dive into these effects that maybe the mainstream media doesn't necessarily touch on. So I know with like the Russia-Ukraine example, we touched on how the supply chain shortage, getting foods to Africa was stopped because one of the harbors in Ukraine was actually, blocked off for a period. So there are these items that we touch on in our sessions that, people may not necessarily think, oh, it's a one-to-one connection. This is A causes B, but what we do here is kind of evaluate that ripple effect and how this impact does actually come back and impact us on a personal level. So what we're doing here with the currency, we've been watching lately, and obviously what we're going to touch on in this particular session is some of the recent updates with China and the yuan currency that they have. But even just following the economy as a whole, we've touched on the U.S. Retirement fund that people are going to be impacted with and how the stocks are going down with the economy. So we just want to remind everyone, we are touching on these topics, but we are also going to pull them back in and have a central theme on what we're covering.
So I want to check the debt clock that we had. We haven't checked that for a while, right? So let me just check that very quickly. So then, because when I shared this with you.
Yeah, I know. I think it went up, it was like $1 trillion in the 1 year from when you started. I think it was from 2019. You saw that jump by 29 trillion to over 30 something now.
Very quickly, because that's a good starting point for some of this. It was 31.5 trillion we were at, and now we are, 21.6 trillion is where we are today. So pre-COVID, that number was 19 trillion. So
For the U.S. national debt? Oh, okay.
So now there is almost doubled since COVID started. Now, let's try to actually have a meaningful conversation around this. So, because of my background, was being born and raised in Turkey, and then being in this country for almost 25 years now. And then I'm still able to follow what's happening in Turkey. So then since we have our office there as well, so 2018, when we opened the office, I would have $1 and then go and exchange it for $4. This is 2018, so it's 5 years ago. Today, it's $19. So 19 Turkish lira. $1 is 19 Turkish lira. So it went from 4 to 19. Now, when you look at these issues from the US standpoint, economy may not be affected by the world events as much as other countries are being affected, and Turkey is one of those. Other countries who are not in the top 10 probably have the similar issues. But what makes us unique, what makes United States unique is, and our biggest advantage is, the world currency is US dollar. So we want to make sure if whoever is watching us is able to have some understanding of what type of advantages we have, and then in case we lose this advantage, what may be happening. Now, since this is kind of like a dialogue, I do want us to kind of remember the tension, the term tension, and the pressure, which is the same, but I do like the tension better. So let me just give you a quick background, and I'm not gonna go too far out from the topic, so we'll keep it together. So when we were trying to get a fair market values for our services, for the urgent emergency care services, emergency surgery cases at Christiana. So they hire someone, an expert, and then this expert is looking at what Christiana needs and what we need and what we are presenting, and then they would give us a fair market value. So let's say you are going to have 24/7 coverage for the surgery services. You need X many surgeons. You need this many that, this many this. So the service may worth, like, let's say 1 million. But we are going to actually use the percentile, and then we'll stay at the 60th percentile. You may not get the whole million, so you may be getting lower. So the 60th percentile usually is kind of safe for these. And then when we hire someone else to do the same study, this someone else says, well, it's not 1 million, it's probably 2 million. So it's that expert's opinion was very different. So then we said, okay, let's just have a conversation with the hospital, with you guys, and then see why we have a big discrepancy between the two. And then the guy goes, look, it's all about tension. How much tension this receiver or buyer has, or how much tension the seller, the vendor provider has, so that we can actually we can value these services. So let's say if I want to sell you this, you guys got me this for the for Christmas last year. Okay. So how much would you want to pay?
A flat 1,000. How much would I personally want to pay?
Yeah, right now, how much would you like to pay for this?
I'd like it for free, but I don't think that's an option.
Free, right? Because you have no pressure to buy this.
Yeah.
Now, I don't want to sell it for 50,000 because I don't have to sell. Yeah. And it's important that my employees got this for me, meaning that there's no pressure.
Exactly.
Right? So I'm going to put this later on. So you see how we couldn't agree on that. Zero tension. Yeah. Without the tension, there's no value. So you just bought a house last year. If you were bidding on that house with 3 other people with the same price.
Mhm.
So buyer has zero tension. You guys, buyers
So,
have a lot
yeah.
of tension. The seller has zero tension.
Yeah.
So what was going to happen? Someone was going to pay more for the same
Exactly.
house. Now, this is from the practical side. This is important. Why? Is because now the global issues are working very similar to how the big corporations are working,
Mhm.
or in some cases, how personal issues are happening. So it's very similar. So let's keep it on the business side, and then each country you have to really kind of see them as a big corporation. Now we are all competing.
Mhm.
Okay. Now, because we are in one big market as the globe, as the world, then whatever is happening there is affecting everyone at a different level, because whoever has the more control, the other leverages.
Right.
So then that country has more advantages. So since the Second World War, the US dollar is the world currency. Now, what does that mean? So you go to, let's say, if you're in charge of Turkey's economy,
Mhm.
and you have to invest and you have to buy stuff, you have Turkish lira, right?
Mhm.
So you have to switch your money,
Yeah.
exchange your money to US dollar to buy that from Brazil.
Mhm.
So, well, US has nothing to do with what you are doing there, but
Right.
in order for you to do that, you have to exchange your money
Yeah,
first.
that middleman.
So that's the currency. That's a huge power.
Mhm.
It's almost like, in a different analogy, I use a lot of analogies in these. Like English is like similar to the US, the currency issue, right? So
Mhm.
everyone has to almost now learn to speak English in order to have a good communication with other countries. Even for touristic trips that you have, you need
Mhm.
to at least know, if you know English, you won't be in trouble. Because if you are in Beijing, they're going to speak to you in English anyway. If you're in Turkey and the touristic areas, they're going to talk to you in English, right? So this is the economic part of the leverage that US has. Now, why did I actually mention this tension issue, and then why did I give that example? So when we have this leverage, and we use this leverage if we are out of proportion, if we go out of proportion when we are actually, we know that we have benefits, but then if I misuse that benefit, meaning that I'm going to have sanctions on country X if you do something against my will, and it doesn't have to be legal or illegal.
Mhm.
So because I'm controlling the currency, I can say, well, you cannot do that. The Swiss system is not going to allow you to do that, right? So did we use that? Did we get to that point? Or did we mismanage our economy? Those are all important questions that we need to answer. And in my opinion, we did. And then I think now what's happening with the sanctions being misused, the economy being not managed well. The other thing is the crypto money.
Mhm.
So last week when Lydia York was our guest, so then I wasn't actually going to talk about the currency issue, but it did come up.
Mhm.
So while all the troubles are happening, Bitcoin is still very strong now.
Yeah.
So it didn't go down just because we have issues, because now it's an alternative. So now, do you really need this paper currency system, or how much do you need that? Or do you need that same level? Or now do we have alternatives?
Yeah.
So one important thing that we need to remind people is the BRICS. BRICS is the Brazil, Russia, India, China, South Africa. They get together, and then the reason for this one is to become an alternative to the US dollar.
Mhm.
Now, those countries are saying that, well, they're going to use yuan. We couldn't agree on how to pronounce. In Turkish, it's yen, and yuan is in English. We are going to use yuan anymore instead of dollar. Now, guess what happened? So they also become the global South alternative to G7. As you know, G7 is the strongest 7 economies. And then they have a contingent reserve arrangement. Now that it's serious thinking of Saudi Arabia, UAE, Egypt, Algeria, Argentina, Mexico, and Nigeria. So now, all of a sudden, because they have too much tension for this advantage being taken advantage of. So that created so much tension. Now there is that alternative. Now, not to go out of topic, but going back to our relationship with Christiana Hospital, we are always so thankful for them to do this, put this tension on us, because then we own our surgery center. If they didn't do that, maybe we were still going to provide that service. And then my doctors who are in their late 50s, early 60s, maybe they still were going to be on call 24/7. Now we said, okay, you know what? What's the alternative? So because I don't want to live with that tension, right? So that's how where we are today. So and now this issue is becoming more serious every day. Now,
so like you're saying right there, that example, when you're putting this pressure on, obviously, once that threshold is surpassed, you have to find an alternative, as you're saying. So you're not gonna be able to sustain living with this type of economic pressure on with these exchange rates, as you mentioned, even Turkey going from, you said it was $4 or $5 lira. Yeah, so that's like an insane jump where, think about it, it's just going to continue further. It's hard to sustain that type of economy, you know, when you're constantly battling uphill. Now, on the reverse side, though, you're saying someone in the US, when you have that power, that leverage, now is it a little bit scary for the US now that we're losing these potential big players in the global market that are going to use an alternative, you know, a different product they're searching out, so to speak. So obviously it's going to impact the US tremendously if these countries then maybe motivate or show like, oh, like if they're doing it and they're succeeding, they're saving money, you know, they're getting more bang for their buck, so to speak. Maybe they'll also then change, and that's where that shift in power you're going to see.
Absolutely. So that's, I don't think we're going to have like 6 different alternatives, but if we have another alternative,
that would be a common one.
There will be a lot of that tension will be a lot less for those countries who are in the middle. So let me actually give you an example. So we tell the US says to Turkey, this is real. You cannot do any trade with Iran.
That ban was.
Well, Iran is our neighbor. So we say because Iran is not listening to US, but it has nothing to do with Turkey. And Turkey is your neighbor. So then you have to do
pick that side. Yeah.
You have to do trade, but then you cannot use your own money. You have to use dollar. And then it says, well, Swiss system is not going to allow you to exchange the money because you cannot. That's the sanction that we're talking about, because Iran wants to do their own nuclear. Well, South Korea, North Korea has nuclear weapons. So, well, but we're okay with that, but we don't want Iran to. And then because of that, don't work with them. If you do, we are going to penalize you.
Yeah, trying to excommunicate.
They actually did have a case, court case in New York, and the defendant was one of the biggest banks in Turkey, Halkbank. And they said, well, you didn't follow the rules that we had. Whose rules, right? Well, my rule. US rule. But we have to work with these people. We have to do business with them. And then like, who's going to actually cover my loss from that country standpoint? When I don't work with them, I'm not able to do the trade. Who's going to actually compensate that difference, right? So it doesn't matter. If you are powerful, you are right. That's the world that we live in. Now, remember, we both live in this country, and part of the maybe beauty of this country is that we are still able to have this conversation without getting in trouble. But there's still that other side of it, that if everything we do is right, that's not the case. So it's not. So now we have to figure out what's the right way to do it. Now, the bad news is there's no right way. So this is a hardcore competition game, and one of the reasons, again, this issue came up is because I think we are going to have more trouble in the world, around the world, because of these shifting is already happening. So to stop that, I think we'll have more trouble around the world, and which we already have those conflicts. We didn't talk about the Scotland's new prime minister, who's a Muslim guy currently from Pakistan. So it's so interesting, right? So this is kind of like, I was talking to one of my friends yesterday. So 5-6 months ago, England had an Indian prime minister, and now 6 months later, Scotland has a Muslim Pakistani prime minister. And what's the biggest conflict between Scotland and England? Great Britain is Scotland wants their own independence. Now, just think about what happened between India and Pakistan. So there will be a smaller version of that, maybe perhaps in the west part of Europe. And it's really funny in a way that, or ironic, or I don't know, whatever you want to call it. So now you have two really important countries have an Indian and Pakistani prime ministers who are going to now go against each other. Now, that may not happen. I may be wrong, but let's see. Usually we are right. So, but it's like, because that, in order for that to happen, we need to have some elements in the right place. And the elements are the Pakistani and Indian guy as a prime minister. Like, what the hell? Like in England, so you have an Indian prime minister. Would you ever think of that? No, because they killed their own princess because she was dating with a Muslim guy. Now there's an Indian prime minister. Scotland, the most widest country ever, probably now has a Pakistani prime minister, and he was actually praying like for the Ramadan on his first day, and then he's posting pictures while he's praying. Okay, so there's something happening there. France already has a lot of issues, right? We never thought Ukraine and Russia was going to happen. It happened. It's the second year that we're in. Sri Lanka, Taiwan, the Central America, Africa, they all have those great conflicts already happening. And I think part of it is because this shift from US to potential alternatives is initiating or incentivizing those, motivating those actions, but who knows?
Yeah, I think, like you're saying, whoever has the power is right. I think this exponential growth of power, like if you think about the US just in terms of being a relatively young country on the global scale, declaring independence from England, the fact that we were able to grow with such, exponentially fast and at a rate where all of a sudden we surge, and we're just, kind of have our influence on the world, where, I don't know if you remember the one political cartoon back in the day, but it had the US with kind of like the octopus arms just reaching out, touching over the whole world. We have influence on all different parts of the world. It's kind of what we want happens.
So this should happen. I don't think we can blame our country.
I mean, yeah, it was, I was going to say, like, obviously the revolution, and what we want is, we want the power to the people, the Revolutionary War, and the whole model behind that, you have the power of choice, you choose your destiny type thing. But at what point does that arm reaching out to other countries? Obviously, you want to influence them in positive ways, liberate certain areas, for example. But I think when other countries maybe look at the US saying they're telling us what to do, that's where you get that pushback of that barrier. And that's why maybe alternatives are trying to be.
Well, I think we went too far with certain things, and we lost our focus from US standpoint. So read that for me. So because if US doesn't wake up
or woke up. Yeah,
so,
exactly.
Right. So because we are spending way too much time, and we are consuming our energy into not productive discussions, and and trying to make it so difficult to do the trade, do the work in US, it became extremely expensive, and then now everyone is looking for alternatives. So that's why we have to be responsible. And one of the things that I want to actually share. Treasury officials in Obama, Trump, and Biden administration have cautioned that extensive use of financial sanctions could threaten the central role of the dollar. And this is this is what actually we are seeing now. Focus on the core, right? So if U.S. doesn't produce, we just borrow and then we just print money. There are consequences. It's not as quick or severe as if some other country is doing it because of the global currency advantage, but it's not forever. So it's not extremely safe. It's not. So this is why these discussions are happening right now. So why is China and Brazil and India and South Africa and who was the other one?
Nigeria.
Brazil, Russia, India, China, South Africa. Why do they look into this coalition? It's because enough is enough from their point. So that's why the balance is important. But in order to keep that balance, our focus has to be at the right place, and our focus is not in the right place. Now, on Tuesday, this coming Tuesday, perhaps we are going to arrest the former presidents of the United States, which is a huge, humongous mistake. It would be, and it's happening. It's approved yesterday. It's voted, and if that happens, U.S. is going to have more issues, internal issues, which it's going to set us up for more trouble in the near future. So I think it's okay for Bill Clinton to get a blowjob in the White House, but it's not okay for Trump to pay this stripper, $80,000 or $100,000, his own money. But now he made it so political, so motivation is so political that no, he's going to go to jail, but Bill Clinton is going to be our hero. That's the world that we live in, and that's why we are getting in trouble and having these issues with other parts of the world, which may affect each U.S. citizen here. Because for what we pay for $1, people in Turkey has to pay $20. People in Ukraine has to pay $25. People in Tigray needs to pay $50. So that's the world that we live in. So if we are going to be irresponsible and do those things, I think things are going to get really out of control. And so far, everything that I didn't think was going to happen happened. So, and hopefully someone actually stops the train, and at least what's coming up next week can be stopped, because that's going to be otherwise extremely severe. The consequences will be really bad.
Yeah, I think, like as you're saying, the shift is, I wouldn't say it was bound to happen, but like there is that threshold where you can't flirt with that line over and over, and then once you stay past and not get back, and then
it's a fine line.
Yeah,
right? So that balance requires the expertise. Requires someone who's not Biden, because Biden can't handle his own day-to-day tasks.
Yeah, you have to.
And I feel sorry for him. I work with him close. I know him not too close, but I know him enough. He shouldn't be in charge of this country. Like with the issues that we have today, someone who is more alert and able to do her own task, at least, should be required, because otherwise we are going to be in more trouble. And I know we have other things to talk. So the reason I want to get into this, so then this was one of the main things. So I know you could.
Now
I forgot
about
COVID.
12, 13 minutes. Yeah.
So let's do the COVID, and then I do want to also talk about Dr. Erkan's book.
Of course.
And here's our COVID update. After this, all the depressive news, so you're going to have some good news from COVID.
Yeah, so COVID update is actually good in the sense of no news is good news, as you said earlier. So we're seeing that these cases are actually somehow decreasing more. I mean, they already were consistently low, but we're seeing even lower numbers of both cases and then mortality. So it seems, I don't know, like in my opinion, I haven't really seen any, it seems out of the news, COVID just seems, there's no more strands coming out, recently that we've seen that are causing any exponential surges. I know it was the winter last year that we saw the Omicron where that was a big surge, but since then there hasn't really been another variant or anything alarming in that sense. And I feel like it almost seems like it's stable. I know with the different states ending that emergency, no longer in the state of emergency for the COVID pandemic. So it seems like we're on the move there.
And I think that the season is right as well, because we are going into the summer.
Right.
So things were going to be more in control, but already I think we are in a better shape.
Definitely more stable, I would say, yeah.
So now, one of my best friends and our co-chair of United Medical ACO, Dr. Erkan, published his first book. Congratulations. So we met in 2003, Dr. Erkan and I. So that's 20 years. It's like 4 years after you were born. We met. So it's a long relationship, and it never had any trouble. And in time, he became one of my best friends. And I think he's one of the nicest people I have ever known and smartest people I have ever known.
Mm-hmm.
So I do want to give you guys a little bit background on me personally, and also how this is related to Dr. Erkan's story. So I'm not a big fan of PDA. So it's PDA.
Public display of
affection. So now after my puppy got sick and then I lost him, so it changed a little bit. But prior to that, no one saw me crying in my adult life. And I try extra hard not to do that. But of course, after that, I cried on a live session and other stuff, but that's after Buddy. But let's keep it before that. So 2014. So I knew Dr. Kemal has some background with the, like he left Ethiopia to Sudan and then came to Italy. But I thought it was kind of more like a trip from one country to the other. So, but he never also told me the whole story. So now I'll come back to this. I just want to give you guys one update in the more recent. So when Tigray conflict started in 2019-20, we started having live sessions for Tigray and giving updates from what's happening, trying to reach out to the US officials here. And then we set up one of our first nonprofit organizations called Friends of Tigray. Now, Friends of Tigray actually now is Friends of Tigray and Turkey, because we are going to utilize that organization to help the earthquake, people who are affected by the Turkey earthquake. So that's now the name is Friends of Tigray and Turkey. Now, because of this new conflict in Tigray and Ethiopia, I had to go back, and that's why he started actually writing this book. So now let's go back to 2014. So we are at the airport, and then Dr. Erkan and we were coming back. Then he had a United Medical jacket on, so I didn't. So one of the guys kept looking at him, and then he came up to us, and then he said, "Are you a doctor?" Well, it says United Medical. He's a doctor, so I mean, good
assumption. Yeah.
Good assumption. So then he started trying to say that he knew Dr. Erkan, but then Dr. Erkan couldn't remember him. So, and then I'm watching them. So, okay, in my mind, this is 2014. I'm like, so two black guys. So one of them is trying to tell the other one that he knows him, and the other one, my guy, says, "No, we don't know each other." I'm like, "Oh, well, is he trying to take advantage of the doctor here?" So that came to my mind. I feel so guilty. So then our flight canceled, and this guy says, let's just sit down and talk. And then Dr. Erkan started remembering him. So apparently the guy was actually his 1 year junior from him in elementary school. And they used to go to school together. And because Dr. Erkan is a senior to him, so he would walk with him from home to school, school to home. So speaking of the PDA, so I may actually not continue this, so I thought I was going to be able to put it. You can continue.
Sure. So what we have here that we're just we want to mention, obviously, Dr. Erkan does have his book being published, and it did recently launch. You'll see it on Amazon. We do have that slide here for people that if they want to purchase it. Obviously, it is a very emotional book, very touching, and we know that he's put so much work into it. And we know Kemal also by his side helping with the peer review and the amount of dedication put into this book, and that finally people can actually share along with his story and his experience and better understand him as a person.
Well, as a person also understanding what's happening in those regions. So this guy actually explained and told us this whole story, and the flight was canceled for 2-3 hours. And then we were in the restaurant in the airport. I think we were in Houston. And I don't have a sad story to tell someone. So like I left Turkey and I came here and everything was fine. I went to school, blah, blah. So then boom, you look at these two individuals and their life story is so similar, so parallel. So instead of from Sudan to Italy, this guy is an engineer. He went from Sudan to Spain, but they became so successful. He became a very successful engineer, and Dr. Erkan is one of the best bariatric surgeons in the world. So, but then I was also admiring Dr. Erkan at the same time. How did he keep all this from me for 12 years then? Because this is 2014. We knew each other for 11, 12 years. Who knows? And then understanding how much pain they had to go through. His dad being killed in their living room while he was 15, and by his own people, by the country's own soldiers, and this family of 7 and their mom, what they have to go through. I think everyone should read it. So I was initially I was able to. I was part of the group that I was able to give feedback, the review, and I did read it 2 or 3 times in 2020, 2021, and so finally he finished the book, so it's published. So that also kind of motivates me to finish my book. My book is not going to be sad. So we have business stories, but it's nothing similar to his. I think his is better, but it does motivate me. Like everything that we do with him, it gives me a great perspective. So when you feel down, Dr. Erkan is your guy to talk to, and then he's going to put it in a different perspective for everyone. And he's one of the nicest and smartest people I have ever known. And I think this book is going to give a lot of information to those who may be so foreign to these issues. Well, I apologize for getting a little bit emotional, but every time that issue comes up, it's a little bit still fresh. And I'll try to do a better job next time. But now Dr. Erkan is going to join me, and then he doesn't know, are we almost 3 p.m.? No, he actually didn't know that I was going to do this. So hopefully he's not watching, but I'm going to see him tonight.
Sure, he's watching.
Now, the issues on the economic side is important. We are going to keep covering that. Hopefully, this Tuesday is not becoming another disaster in our history. And hopefully we can have better tomorrows. Well, we'll see you guys in a couple of minutes. But for this event, we'll see you next week. Thank you for joining us.